This is the recording for chapter one. I promised that I would record it because to make sure that you all get a clear understanding um, due to the little situation that we had in the room, little heat there. However, mental health, as we look at mental health versus mental illness, mental health is a state of well-being on which individuals reach their own potentials. They cope with their stressors. There are stressors going on in their lives. Mental health, they have ability to cope. They can work productively and also they can contribute to the community. This is mental health. Now, these clients, for the most part, they have developed coping skills, whether it's on medication, whether it's therapy, or both. But however, they are able to cope and be productive citizens. As we look at the traits of mental health again, people have the ability, those clients with mental health, they have the ability to think rationally. Could they have ability to have good communication skills? They can learn. They can develop, have emotional growth. All of they're very resilient. Also, they have look at their self-esteem. These are just some traits of mental health for the most part. And I think we looked at the kind of the little diagram in the book where we talked about mental health, those different traits rather. Now let's take a look at mental illness. There's a little difference. These clients, they have a definable diagnosis. They have some significant dysfunction in their mental functioning, um, related to it could be developmental, it could be biological, or it could be related to some physiological or emotional disturbances. So when we look at mental health versus mental illness, we look at the two. We could do the comparison there. And when we look at mental health, for the most part, like I said, and these clients with mental illness, they can also cope. They develop those good coping strategies and be lead productive lives. And again, um, as we look at mental health again versus mental illness, there's a real middle ground which exists there. Stress and discomfort from the everyday life. And again, mental health and mental illness versus mental health versus mental illness. I'm sorry. There's a conceptual point, along the mental health continuum here. These clients, again, you look at the physiological aspect versus the psychosocial aspect of these clients. So we kind of looked at this case study in class. Again, we talked about Miss M when she came into the clinic, reporting feeling of hopelessness. She worked full time and she's dealing with the troubled teenage and her elderly parents. So she's confined to you that she cannot deal with her life right now. So we kind of had that discussion in class. Going back to the attributes here, some of the individual attributes of behaviors, when we talk about resilience, this is where the client has the ability and they're capable to secure their resources, or we again, and that are needed to support their well-being. And when these clients cannot cope or they do not have the adequate resources, then again, they may have problems coping. So again, this is again they can secure their needed resources. They can they have the capacity for regulating their own emotions and overcoming negative and self-defeating thoughts. But however, again, when those clients cannot cope or they need resources, this is where mental health nursing or mental health care, I'm sorry, comes into play. These clients can recover, but however, we have to look at those factors, those barriers that may prevent them from recovery. Looking at their social and economic circumstances. Are they having problems with their family? We just noted that this case study, this Miss M had problems dealing with a teenager. Then she also have she's caring for her parents. So we look at those factors, and then the environmental factors also play a role. Culture, then again, social and economic policies as well. These are risk protective factors. Also, when I go back to the attributes here, we talked about those. Everyone has would love to have the ability to think rationally. They would like to have effective coping. So this is the attributes that we would like to see in the individual. Also, be able to control their emotion, their self-control, self-awareness. okay, developmentally on task. We talked about the stages of development. Everybody do not develop at the same speed or same rate. Also, the significance of their spiritual satisfaction. Everybody want to be happy and joyful. Everybody wants to be able to take care of themselves, self-care. When there's a break in either of these attributes, again, it could lead to mental health or mental illness. Positive and self-concept, learning and productivity. Everybody wants will have the capability to learn and be very productive, and also possess those effective communication skills and have a meaningful relationship. So this is basically some of the attributes you will see. Again, when there's a break in the continuity of these any of these factors here, a person is at risk for of having some mental illnesses or mental health issues. So again, going back, mental health versus physical. So we looking at when we look at mental health and mental illness, we're looking at the physiological and the psychosocial aspect for the most part. And we talked about that Thou thesis stress model. And basically, it's basically biological predisposition. Thou thesis, that's what that means. Stress, whether they're environmental stressors or trauma. So this is the most acceptable explanation for mental illness when there is some environmental stressors or trauma that may cause someone to have mental illness. So a combination of these two, again, combination of diathesis stress is basically genetic vulnerable and negative environmental stressors. So it could be those stressors could be biological in nature or it could be due to environmental stressors. So the assertion is that most psychiatric disorders result from a combination of genetic vulnerability and negative environmental stressors. So either somebody is born with it, or it's genetic in nature, or something going on in the environment. And we talk environmental stressors could be things like poverty, homeless, lack of resources. So that's that. Those are some factors there. So Ms. M has a history of major depressive disorders. Do you have to deal with that? She says, can't we just focus on my insomnia? So she don't want to talk about the truth or the root of the problem. And as I said again, if we know the cause of the problem, we can fix it. If I could just get something to help me sleep at night. So she's not trying to determine I mean, she doesn't want to talk about what's causing her to have these episodes, can't sleep at night. So she just wants something to help her sleep. Um, and she's stating that insomnia, okay, I'm sorry, would be covered by her health insurance. And so again, she also talked about how it's difficult for her insurance companies to pay um, for anything. So again, we kind of talked about the Parity Act, which we're going to talk about in just a minute. Talking about how it's important for insurance companies to cover mental health or mental illness disorders. Social influences on mental health, again, I kind of hit on that a little bit. These are different alliances here, or also alliances as well as projects talking about how important it is that mental health is covered. Mental health care is important, rather. Um, and then the legislation in mental health funding. We kind of talked about in class how it's important that we looked at the Mental Health Parity Act. That meaning that equivalent, everybody is due equality health care. So the Mental Health Parity Act requires insurance companies to provide equal treatment coverage for psychiatric disorder, as well as, again, they're covering hypertension. So again, that's a physiological disorder. So this act requires that the companies cover psychiatric disorders as well. Then you have the Patient Protection and Affordable Care Act, which also provide coverage for most uninsured people, Americans, through expanded Medicare eligibility, the very poor, and also create health insurance exchanges to offer more choices. So it's mandate for coverage, basically what that means. Epidemiology of mental health disorders, based on some studies talking about, and I need to expand this just a little bit. Give me a second. So when we look at epidemiology, we look at the study of mental health disorders for the most part. We're looking at those clients that are high risk, those populations of people that are high risk for developing mental health disorders, and also the pandemic, or I'm sorry, the psychiatric evidence to support um, mental health. Clinical epidemiology, again, looking at those again those individuals with specific mental health disorders. Again, there's a question that you can look at as we talk about classification of mental health disorders. We talked about that DSM-5 manual, how we look at it. That manual is used, I'm sorry, to diagnose, and also there are guidelines or specific guidelines on how to diagnose these disorders. So again, it's based on certain criteria that must be met in order for a client to be diagnosed. Also, when we look at there's ICD-10 manual that also is more broader. It looks at specific clinical descriptions or mental health disorders, looking at more classification, kind of break it down a little bit more. And also, those manuals are used again, like I said, to diagnose and to treat, looking at clinical interventions as well. And as we talk about nursing, mental health nursing or psychiatric nursing, health nursing, those nurses will require skills beyond the basic. So nurses, those mental health nursing nurses, they promote mental health through assessment. Same thing we would do with the client with a physiological problem. We assess, we diagnose, we treat the behaviors and also the disorders using nursing professional and theories and also research. So again, mental health nurses they're employed in a variety of settings. Again, as we talk about the DSM-5 manual and ICD-10, there's also an international classification for nursing practice, which helps the nurses to look at standardized nursing diagnosis. Based on those standardized nursing diagnoses, also there are different interventions that falls under those diagnoses. So it's pretty much help us to diagnose from a nursing perspective and implement those nursing interventions. Mental health nursing education level, again, like I said, you have the basic entry and usually depending on where you're working. If you're working in a psych unit, they require that work at least 2 years full time, have at least 2,000 clinical hours, 30 continuation hours. And then again, the advanced practice nurse, on the other hand, this nurse is able to prescribe in certain states, I'll put it that way. They have prescription authority when they can write prescription. And then again, this is another degree. It's an advanced practice nursing degree, and then also mental health, a master's in mental health or DNP practice. So these are different levels. There have been some trends in affecting the future of mental health nurses, educational challenges also. Uh, um, Let me just rephrase it. Trends affecting mental health in general, the future. You have a lot of people living longer. So again, there's going to be more need for mental health specialists because you have people living longer. Also, cultural diversity is another big factor affecting the future. It's scientific, technology, and electronic healthcare, advocacy involvement. So again, there's a lot of things that's going to be impacting the future, not just for mental health, but for healthcare in general, but specifically for mental health because there's a lack of resources. And I think we talked about the rural population or the rural communities where there's a lack of resources, a lack of psychiatrists, a lack of centers, outpatient centers. So again, there are going to be some things impacting or affecting the future of mental health for the most part. And this pretty much ends this lecture for chapter 1. Again, as you study, make sure you go back and remember or focus in on the Mental Health Parity Act, the difference between mental health and mental illness, and also kind of focus in on how do we diagnose? We talked about the DSM-5 manual, and that manual must be used